Hello everyone. Today, we're going to talk about the 8 alarming signs that our body gives for colorectal cancer, also known as colon cancer. According to the World Health Organization, colon cancer is the second leading cause of cancer-related deaths worldwide. The risk of colorectal cancer increases with age, with most cases affecting individuals over 50 years old. The primary risk factor for developing colorectal cancer is age, but it also includes factors such as family history, an unhealthy lifestyle, or personal history. When it comes to lifestyle, we're referring to risk factors like smoking, alcohol consumption, sedentary behavior, obesity, and a diet low in fruits and vegetables, especially heavily processed foods that contain few fibers and numerous health-harming chemicals. So, to help you better understand the main symptoms your body may present in relation to colorectal cancer, let's now discuss the 8 key symptoms. First symptom, change in bowel habits. Some people have the habit of having a bowel movement right after breakfast, while others do it 2 or 3 times throughout the day. On the other hand, some may only evacuate 2 or 3 times a week. Changes in this pattern are common with age but are not usually a cause for concern by themselves. Changes in bowel habits can vary based on the location, size, and stage of the tumor. Stools may change in consistency and color, and the frequency of bowel movements may increase or decrease. A significant sign is when a person experiences episodes of prolonged diarrhea without an apparent cause, followed by periods of constipation, and then again by diarrhea. The tumor can interfere with water absorption and stool formation in the colon and rectum, leading to intestinal blockages or obstructions. While these changes are not exclusive to cancer, their persistence, especially when combined with other symptoms, highlights the need for medical evaluation for an accurate diagnosis and timely treatment. Colorectal cancer is treatable, especially if detected in early stages. Second symptom, blood in stool. Colorectal cancer can cause bleeding due to tumor growth. This bleeding may not be visible to the naked eye, but, in some cases, stools may have a darker color, approaching black, or present a reddish hue if the bleeding is closer to the anus. Bleeding can be caused by the presence of the tumor or wounds that form on the intestinal surface. At times, you may notice a brighter bleeding, dripping into the toilet after you evacuate or when you wipe with toilet paper. Of course, other factors can cause this, such as hemorrhoids, anal fissure, or even if you've consumed a lot of beets, but it's crucial to ensure it's nothing serious. Bleeding can occur in different degrees, from small amounts of blood in stools to severe hemorrhages. Third symptom, abdominal pain. This occurs because the tumor's growth can press on nearby organs, causing persistent discomfort. Additionally, cancer can lead to intestinal obstruction, causing abdominal pain due to irritation of nerves around the tumor, which can also contribute to the sensation of pain. It's important to note that abdominal pain caused by cancer tends to be persistent and doesn't alleviate over time. If you've never experienced abdominal pain and now have started feeling intense cramps that don't go away and keep coming and going, or even pain during bowel movements when the tumor affects the rectum portion, seek help. Fourth symptom, fatigue and tiredness. The often unnoticed but constant loss of blood due to cancer can cause anemia, contributing to the feeling of fatigue. Additionally, the body may become overwhelmed while trying to combat the presence of the tumor. Note that this isn't the fatigue and tiredness you experience from lack of sleep, but rather a more prolonged fatigue, lasting for 2 weeks or a month. The tumor may be slowly bleeding, leading to anemia without an apparent cause, a major factor in colorectal cancer. Cancer cells use a lot of energy because they need it to divide rapidly. Moreover, cancer may be consuming your nutrients, contributing to chronic fatigue and tiredness. Fifth symptom, abdominal bloating. The tumor can cause partial or total obstruction of the intestine, resulting in the accumulation of gas and stool, causing a bloated sensation. Additionally, the tumor can press on nearby organs, contributing to the feeling of bloating. Another point is that the tumor can hinder the passage of food and liquids, leading to abdominal bloating, and this excess gas can cause abdominal pain, cramps, or even constant discomfort. If you notice persistent abdominal bloating, especially if accompanied by other symptoms like abdominal pain, changes in bowel habits, fatigue, or bleeding in the stool, it's essential to seek medical evaluation. Sixth symptom, unexplained weight loss. Our body may be using more energy to combat the presence of cancer, resulting in weight loss. This happens because the tumor can alter the ability to absorb nutrients and calories, essentially acting like a parasite, absorbing everything for itself. As the tumor uses a significant amount of the body's vital energy, it not only consumes fat but also lean mass and muscles. Cancer often triggers an inflammatory response in the body that can lead to the breakdown of muscle tissue. Moreover, some cancer cells have the ability to produce substances that affect appetite and metabolism, contributing to weight loss. Seventh symptom, feeling that your intestine hasn't fully emptied. The sensation that the intestine hasn't been completely emptied, also known as rectal tenesmus, can be a symptom associated with colorectal cancer in some cases. However, it's important to highlight that this sensation isn't specific to cancer and can occur for various reasons. In the context of colorectal cancer, this sensation may arise due to the presence of the tumor partially obstructing the intestine or interfering with the process of stool elimination. Partial obstruction can result in restricted passage of stools, causing the feeling that the intestine hasn't been fully emptied. Eighth symptom, nausea and vomiting. In more advanced stages or cases of severe intestinal obstruction caused by the tumor, these symptoms may manifest. Obstruction can lead to the accumulation of food and liquids in the intestine, causing abdominal discomfort, distension, and, in some cases, nausea and vomiting. If the tumor partially or completely blocks the passage of stools, a buildup of material in the intestine can cause discomfort and pressure, leading to these symptoms. It's essential to understand that this condition is more common in advanced stages of colorectal cancer and may indicate the need for urgent medical intervention. Early diagnosis of colorectal cancer increases the chances of successful treatment and complete recovery. Colonoscopy is a crucial examination to detect polyps, abnormal tissue growths that can form in various parts of the body, before they become cancerous. Awareness of warning signs and the adoption of healthy habits can significantly reduce the risk of colorectal cancer. Watch other videos here that you might like for more signs that your body can give for other diseases. Also, share this video so that more people can prevent and take care of their intestinal health. Thank you for watching our content, and until next time.